My name is Joshua Russell. I'm an associate professor in the Animal Behavior, Ecology, and Conservation Department at Canisius College. And as part of the Making Meaning in a Pandemic course, I'm going to talk a little bit this module about One Health. So, what is One Health? One Health describes an integrative and interdisciplinary movement that recognizes the connections between human health, animal health, and environmental health. One Health is often represented by the triad, which looks at and represents the various ways in which healthy environments, healthy animals, and healthy people all rely upon each other in order to experience or to achieve health in any one of these three areas. The other two are implicated as well. When I say it's an interdisciplinary area of work, probably the two disciplines that come up first and foremost are medicine and veterinary medicine. And certainly those are a key part of understanding One Health, but all of these different areas are important as well. And so I'll talk a little bit about each of these throughout this presentation, and there are some other resources in the module folders that you'll be able to find that can show you a little bit about disaster preparedness if you have pets, for example. Or there's a speech by Sharon Deem, a TED Talk on conservation biology and One Health. So I really encourage you to look at those other areas as well. The concept of One Health is not a new concept. It is integrative, but this kind of emphasis on human, animal, environment connections has been around for thousands of years in many cultures. So for example, traditional ecological knowledge within indigenous communities emphasizes the interactions of environmental, animal, and human health. I have a reading in this folder that can tell you a little bit more about traditional ecological knowledge and how it connects to One Health or systems health. In ancient Greece, Hippocrates, where we get the Hippocratic Oath, wrote in his piece, Airs, Waters, and Places, about the importance of clean air and water for human health and for medical treatment. And scientists in the mid-19th century first began theorizing the possibility that diseases could spread between populations of humans and populations of animals, and began to understand those pathways of transmission a little bit better in the mid-20th century. But One Health really began to get more global attention after the Ebola outbreak in Western Africa in 2003. This is a map of the central part of Africa, and you can see in red all of the areas where Ebola outbreaks have happened since 2003. If you were to overlap this with other kinds of maps, you might also notice that these are areas where intensive deforestation have happened, where human exposure to different environmental degradations have occurred, where there is a lot of poverty, where there is a lot of warfare. And so oftentimes, if we try to think about what causes human illness, we can find the answer in a lot of the ways in which we've inflicted injustices on human communities and environmental and animal communities as well. As a result of the attention being given to the Ebola outbreak in One Health, in 2004, the Wildlife Conservation Society held a conference. And at that conference, they drafted 12 principles called the Manhattan Principles that sort of created the foundation for a global understanding of how these three areas are connected. So there's a link to the 12 Manhattan Principles on the Wildlife Conservation Society website in the links folder. But since 2003, we've also seen incidences of flus being spread around the world, flus that have been called the avian flu or bird flu, swine flu. And these types of flus pass from animal populations to human populations in different ways. And so as we see a global increase in the production of poultry or beef or pork, then we also see an increase in potential for the spread of these different diseases. And especially avian flu or bird flu has begun to be seen all around the world in different populations of birds. and in many cases being spread into human communities as well. So most One Health work emphasizes the increasing spread of zoonotic diseases globally. And One Health practitioners have begun to attribute that to several different factors. So one is the ongoing and increasing poverty around the world and environmental injustices. And environmental injustices refer to the fact that where there is environmental degradation or where there are environmental toxins or harms, those typically impact poor communities, communities of color, Black communities, more than they do white communities or affluent communities. And so environmental justice is a movement that tries to work on those issues around the world, but it is certainly a part of the One Health movement. Climate change is another factor that has increased the spread of zoonotic diseases around the world, especially when we think about animal migrations changing, especially animals like mosquitoes or ticks that are now being found in new places where they weren't before. And those animals can spread different kinds of diseases into human populations. The ongoing destruction of wildlife habitat and the decrease in biodiversity and the increase in contact between humans and wildlife around the globe. Intensive farming practices have increased around the world, especially those that are referred to as confined animal feeding operations, which looks something like the picture on the previous slide, where there are lots of animals in a very small space being raised for food. And then lastly is the global increase in the number of companion animals or pets around the world, both those that live in people's homes and those that are in feral communities, so backyard cats or cats that live in communities where there aren't any human beings involved. And I just wanted to take a moment to talk about what a zoonoses is. So zoonoses or zoonotic diseases and infections are those that spread easily between animals and people. So almost 70% of the infections that human beings can get are infections and diseases that can be spread to them from animals first and foremost. Now, there are various kinds of zoonoses. The first are zoonoses that are referred to as direct pathway zoonoses. So those that occur from bites, scratches, breathing in the same air or sharing air, and then saliva or bodily fluids that are exchanged between animals and human beings. The first most obvious one might be rabies. Rabies is a disease that has caused a lot of death around the world and continues to cause a lot of death around the world in human communities and in animal communities. Rabies is spread between different species of animals, and human beings get it from scratches or bites, especially from dogs that have not been inoculated or vaccinated against rabies. SARS, or severe acute respiratory syndrome, and COVID-19, and we'll talk a little bit more about COVID-19 being a zoonotic disease in a moment. Other forms of zoonoses include vector-borne diseases. So vector-borne diseases are diseases that are transmitted through intermediary organisms that aren't impacted by the disease. So mosquitoes, ticks, mites, and other insects. Some of the good examples of vector-borne diseases that are increasing around the world are dengue fever and malaria. These cause millions of infections and deaths around the world and are spread by Anopheles mosquitoes or tiger mosquitoes, typically in the tropics, but as we see from climate change, those mosquitoes are beginning to migrate further north and further south. And so we're seeing these diseases in new areas around the world. Lyme disease, which is spread by ticks, chikungunya, and encephalitis. There are other forms of zoonotic diseases that are spread by indirect contact. So that is contact with contaminated objects or environments. So people and animals may not be in the same environment at the same time, but they both touch and interact with contaminated objects in the environment. And so the disease can be spread that way. One example is salmonella. Another example of zoonoses are foodborne diseases and infections. So that happens when we ingest contaminated food, such as E. coli or tapeworms, Campylobacter. And as you'll see in one of the readings and in one of the videos from this week, there is also increasing attention being given to antibiotic-resistant infections and possible transmission of antibiotic resistance from livestock and from meat that human beings consume. And then the last form of zoonoses is waterborne zoonoses. So that occurs when animals or human beings ingest contaminated water. So probably the best examples of waterborne zoonoses are typhoid fever and cholera, which typically are spread when human beings ingest contaminated water that has been contaminated by feces of agricultural runoff. I just wanted to draw attention too that while One Health tends to focus on microbial agents and physiological diseases, there are also ways of thinking about One Health that recognize the connections between human health, animal health, and environmental health when we think about mental health, violence, and community well-being. And this is especially important when we think about something called the link. The link is a concept that describes the fact that when we find child abuse, elder abuse, domestic violence, or animal abuse, those things often occur in the same households and are perpetrated by the same people. And so this is important in part for our understanding of pandemics like COVID-19, because as people are being required to stay home more, they may be staying home with abusers and people who inflict violence upon them. And so it's important for us to acknowledge that those diseases, that violence and those abuse forms may be occurring throughout the household in different forms. And the link is being picked up by law enforcement officers, social workers, teachers, veterinarians, all kinds of people who work with any one of these groups in order to better understand and look for connections between other forms. So if a veterinarian is looking at an animal that may be abused, will they also see that the woman or the child that have brought that animal in have forms of or evidence of abuse as well? And how do they then reach out to the right kinds of social workers or law enforcement in order to get help for that? So that's something that I think is a part of this One Health integrative concept that might also be not spoken about as much, but is important for our understanding of COVID-19. So COVID-19 is a zoonotic disease caused by the coronavirus SARS-CoV-2. Where did it come from? So if it's a zoonotic disease, then we know it came from animals. And while there have been different kinds of theories about where COVID-19 might have come from, early on, people were saying that it came from snakes. People have also said that it came from bats or from pangolins, animals that were eaten, animals that were confined or slaughtered in wet markets around the world. We weren't really sure. Ongoing research has suggested that it is most likely that the original source of the SARS-CoV-2 virus is pangolins. And so I'll talk a little bit about pangolins. And it's likely that pangolins spread that into human populations, but we're still not 100% sure how. So what is a pangolin? Well, this is a pangolin. Pangolins are a species of mammal. They are covered in scales made of keratin, which is similar to your fingernails or your toenails. They're insectivorous animals, so they eat insects. They're related to armadillos and they're related to sloths. And they're famous for curling up in a ball when they're threatened, and those scaly-like features actually protect them when they're threatened by predators. There are 8 species of pangolins across sub-Saharan Africa and throughout southern and southeastern Asia. All 8 of those species are listed on the IUCN list of endangered species. 3 of them are listed as vulnerable, 3 of them are listed as endangered, and 3 of them which makes 9, are listed as critically endangered. I think that was supposed to be 2 are listed as critically endangered. Why are they endangered? Well, they're endangered for different reasons: habitat loss, but also for their meat, their use in traditional medicines. They are the most trafficked animal in the world. So between 2000 and 2019, estimates are that over 895,000 pangolins were found being trafficked. Most of the time, that means that they were actually dead, across national borders or across different kinds of state borders. And so these are a highly threatened and endangered group of animals. And so we don't know how SARS-CoV-2 may have been transmitted from pangolins to humans. Theories suggest that the most likely route could be consumption, exposure to breathing the same air that pangolins may have been breathing. There's always the potential for a vector-based transmission, so an organism that might have passed it from pangolins into humans. This research is ongoing. But it's important to notice that retaliation against wildlife is not really ever a solution that we should take. So when we find out that diseases are spread from animal populations into human populations, oftentimes that means that people then go out and retaliate against those organisms. They decide to kill off colonies of bats, or they decide to kill off snakes. But that doesn't really work. And really, it is human activity that has increased our exposure and interactions with these animals, and not the animals themselves that are seeking out human interactions and seeking out ways to transmit their diseases to us. So when we cause deforestation, when we cause habitat loss, or when we traffic animals across borders, we are actually spreading those diseases around the world. So the spread of COVID-19 is actually a complex global problem of human economic, social, and political activity, not a problem of wildlife. So what can be and is being done through the One Health initiative? Well, first and foremost, you'll see in some of the readings for this week that there is increasing integrative research around One Health. So certainly that includes human medicine and veterinary medicine, but also research across the natural sciences, social sciences, and even in humanities when we think about ethics and justice. There are improved practices in medicine and in conservation. Sharon Deem's research will talk a little bit more about how conservation biologists are thinking about One Health in their work when it comes to preserving habitats or conserving wildlife species. Biocultural diversity conservation is an area of work that is increasing around the world, which recognizes that if we want to conserve wildlife or conserve natural spaces, that we often have to conserve cultural practices as well, because cultures have lived in those areas for thousands of years. And often they have really important relationships with environments and with animals in those places that have achieved sustainability before globalization and colonization happened. There has been an increase in the number of policies and laws that support One Health. In the links folder under things that you can do to get involved, you'll see that there is, in 2018, there was a proposed law to make One Health the foundation for pandemic preparedness in the United States. And while that law hasn't passed yet and has undergone a little bit of revision, it is still on the books. So if you wish to support that law, you can actually go to the website and provide your own information and sign on as a part of a petition to support that law passing. And also there have been national and international bans, restrictions, and enforcement around wildlife trafficking. Several countries, including China, have since banned the trafficking of pangolins around the world. And further restrictions and enforcement need to happen in order to ensure that wildlife aren't traded or trafficked or poached in these ways. And that the communities that are doing these activities actually have other means of economic support. Oftentimes when people traffic wildlife or when they poach animals, it's not because they don't like those things, it's because they have no other means of support and economic well-being. And so we need to do those things as well in order to reduce trafficking. But what can you as an individual do? Well, obviously you're taking this course and you can continue to educate yourself by going through the other materials on One Health in this module. You can educate others about this movement. You might reduce and choose more ethical forms of consumption, especially around meat, forest-based products, or agricultural products. You might learn to spend more time outdoors and enjoying the outdoors safely. There are ways that you can go and enjoy the outdoors that mitigate and minimize your own exposure to diseases like Lyme disease. Here in Western New York, or I live in Southern Ontario, Lyme disease is increasing as we see more and more ticks surviving the winter because the winters aren't as cold or as long. And so learning how to spend times outdoors safely can help you. Improving your hygiene around animals. And then lastly, supporting policies that promote biocultural conservation, environmental justice, animal welfare, and other One Health principles. So those are all things that you as an individual can do and can support. And as I said, there are links to a lot of these things on the module site. And if you're curious or want to know more, you can always contact me. My email address is russellj@canisius.edu. And I hope you enjoy the rest of the module. Thank you.